Thank you very much, Vartan. It's an honor to be here at the Armenian Radio Hour of New Jersey. I will be interviewing a colleague at Hackensack University Medical Center, Dr. Ellen Hagopian, who is a board-certified surgeon specializing in liver, pancreas, and gallbladder surgery. She's co-chair of the American College of Surgeons National Ultrasound Faculty. Her recently published book, Abdominal Ultrasound for Surgeons, has been widely received by the surgical community. 3 years ago, Dr. Hagopian became the first female American surgeon to be inducted into Les Compagnons Hépatobiliaires. Dr. Hagopian, I must say, Vartan, has had so many other accolades, and she's chaired so many other boards and committees that I don't even have the time to go into detail, but she's a very, very accomplished surgeon, and we're very fortunate to have her as an Armenian in our local community.
I'm really honored to be here, and thank you so much for the introduction. I'm just overwhelmed by your welcome. So my specialization, as you said, is liver cancer. And so many people ask me, what is liver cancer? There are really two types. There's primary liver cancer and secondary liver cancer. And secondary liver cancer is when the cancer starts somewhere else, like in the colon or in the breast, and then it moves to the liver. But what I'd really like to focus on is the primary liver cancer. And primary liver cancer is cancer that starts in the liver. Well, primary liver cancer typically occurs in people who have risk factors. And the most common risk factors that we see in the United States and really worldwide is either cirrhosis or some sort of hepatitis. Cirrhosis can be caused by alcoholism or alcohol exposure. Hepatitis C is a very common cause in the United States, and hepatitis B is a cause that's worldwide. And obesity and diabetes and even smoking have been linked to primary liver cancer.
How is primary liver cancer treated?
Well, the only cure for primary liver cancer is really surgery, and it could be treated by some sort of removal, such as liver transplantation, liver resection, or even some sort of heat therapy. The things that I do with patients as a surgeon is typically liver resection, which preferentially, if patients can undergo surgery, I prefer to do that laparoscopically, which is basically surgery done through small incisions. The heat therapy we can sometimes do with patients too, and if we do heat therapy, which is basically a probe that's placed into the tumor and then destroys the tumor in that way, I also like to do that laparoscopically or minimally invasively.
How can primary liver cancer be prevented?
Well, that's a great question. But the first place to start is really how can we screen patients? And we typically screen patients in folks who are at risk for primary liver cancer. Those people who are at risk are either have cirrhosis or some sort of hepatitis, and we typically do ultrasound every 6 months and blood serum tests for a particular tumor marker. That doesn't necessarily prevent liver cancer, but it picks it up early enough so we can hopefully cure it with surgery. For the general population, how can you prevent primary liver cancer? It really involves a healthy lifestyle, as simple as that is. Measures that you can take is really a proper diet, regular exercise, and weight reduction are really key measures. Obesity and overweightness has been associated with primary liver cancer, so diet and weight reduction and regular exercise are really important elements. And there has been association with diabetes, so really bettering diabetes control and regular visits to your primary care physician are really important factors. Eliminating tobacco and reducing smoking exposure is really important. Liver cirrhosis is a major risk factor, and preventing liver cirrhosis really has to do with minimizing alcohol exposure or minimizing exposure to viral hepatitis. Vaccination is really important. We're now vaccinating all children with hepatitis B, and we're hoping that because hepatitis B is really a worldwide problem, that it's going to hopefully reduce the incidence of primary liver cancer worldwide. If, for example, one of your family members were diagnosed with hepatitis, that person, anyone living in the same household, should also be tested for hepatitis. Early treatment of hepatitis hopefully will eliminate the virus and hopefully reduce that risk. But the most important factor is really minimizing exposure to alcohol.
So what is the safe limit of alcohol exposure?
I get asked that question a lot. You know, unfortunately for we women, our risk for alcohol exposure is actually more than men. And men should really drink no more than 4 drinks per day and no more than 14 drinks per week. Women really shouldn't be exposed from more than 2 to 3 drinks per day and no more than 7 drinks in 1 week. And really importantly, pregnant women should not drink at all. If someone has been diagnosed with cirrhosis or has hepatitis or other sort of liver problems or has had pancreatitis in the past, those people shouldn't drink alcohol at all. But it really has to do with just being sensible and drinking sensibly, and not drinking every day of the week is very important too.
Thank you very much, Dr. Hagopian.